Good morning and welcome to today's webinar. My name is Sean McEwen and I'm the publisher of Inside Aging. And this is, I think this is the third or fourth installment of our Winner's Stories series of webinars, which essentially tell the story behind those highly commended and winning entries from our Future of Aging awards. And the purpose of these awards is really not just to recognise achievement, but share what that looks like in the context of aged care services. And today we're joined by two people who represent Dementia Australia, and the awards, well, I say the awards because we're talking about two award winners here, or two highly commended, I should say. We've got the Enabling Eddie, which is a virtual reality dementia training facility, which is portable in that it can travel to communities throughout Australia as well as overseas. This particular product was the highly commended technology category winner in 2020. And separate to that, we've also got the story behind the Exploring Dementia program, which uses the Enabling Eddie to take the training and the experience of what living with dementia is all about into remote communities, especially First Nations communities. And it's really, I'm very pleased actually to have two people who are very much immersed in the delivery of that program. So let me introduce Kaylee Field. Welcome, Kaylee.
Hi.
And Kaylee's based in Queensland, as you can see there. And Kaylee very much takes, as I said, takes this training into the field with respect to Indigenous communities. And we've also got Clem Hedenek. And Clem, you're in Darwin there. Welcome.
Pleased to be here.
Great. Well, this session is live, so everybody that's on this session, you're welcome to ask questions, and you can type those questions into the chat box at the bottom of the screen. So throughout the presentation that Clem and Kaylee will be delivering, please just type your questions in, and we'll get to those at the end of the session. We've already had quite a few questions that have been asked, so thank you for putting those forward when you registered, and we'll make sure we answer those probably first in the question time session at the end. So without further delay, I'll pass over to you, Kaylee and Clem, to share what this is all about. Perfect.
Okay, hopefully that's it.
Beautiful.
Firstly, thank you, Sean, and thank you to Inside Aging for supporting our work through the Future of Aging Award, and especially for inviting us here today to the webinar to share the story of our Exploring Dementia program with colleagues across the country. As I'd like to begin by acknowledging the traditional owners of the many lands across the country we are gathering from today. So here in Brisbane, we're on the lands of the Turrbal and the Yagara people, and Clem and Darwin is on the lands of the Larrakia people. We'd like to pay our respects to elders past and present, and to our shared futures together. Also, Clem and I would like to acknowledge and thank and pay our respects to the owners of the lands that we had the great privilege to visit when we were bringing Exploring Dementia to First Nations people in Queensland and the Northern Territory. We feel very lucky to have been invited to their lands to share dementia education with them. So Dementia Australia, we are the peak body for people of all ages, living with all types of dementia, their families and their carers. Dementia Australia provides advocacy, support services, education and information for the estimated around about 500,000 people, 500,000 Australians living with dementia, and for the almost 1.6 million people who are involved in the care for these people living with dementia. We advocate for positive change, and we also support vital research. Dementia Australia, we're here to support people who are impacted by dementia, and we're here to enable them to live their very best lives. So Exploring Dementia. So the goal of our Exploring Dementia program is to raise awareness of dementia in regional, remote and First Nations communities through the use of virtual reality technology. And in doing so, it's to improve the lives of people living with dementia through supporting those who care for them. As Sean mentioned, we've been very fortunate with the Future of Ageing Awards. In 2020, we were successful in being awarded runner-up for the Enabling Eddie in the technology section. And then last year, again, another award for taking Eddie out to Indigenous communities. So we received the Future of Ageing Award for the Indigenous communities section. A little bit quickly about the Enabling Eddie, where we started. It was developed by Dementia Australia. Well, actually, it was developed by Alzheimer's Australia back then in 2016, along with Deakin University. And it was designed to allow people to walk in the footsteps of a person who has dementia. We worked with 20 people living with dementia. They told us their stories. They told us what it looked like for them when they were in their own homes. So the program involves some scenarios around what it's like to walk in the footsteps of a person living with dementia. But Clem's going to tell a little bit more about that as part of the program in a little while. So we know that First Nations people experience dementia at a rate of around 3 to 5 times higher than the general population. And yet we're hearing from many providers in remote regions across Australia that dementia care education and access to resources is really poor. Dementia is often poorly understood in First Nations communities, and sometimes it's even thought of as having a spiritual cause, or such as being a curse, rather than having a medical base. There's actually no word for dementia in most First Nation languages. The wishes and the views of First Nations people strongly advocates that people living with dementia should be supported and cared for in their own community in order so that they can maintain relationships, they can maintain connection to their country, and really importantly, continue to maintain their identity and roles within their family, their friends, and their community. So therefore, with all that in mind as to the why did we develop this program? Well, we developed the Exploring Dementia program to provide local health and aged care workers with specialist and unique dementia education delivered in their local community so that they can gain really practical skills to better support and inform those living with dementia and their family and friends. So that's the why we have done it. I'm going to ask Clem to join now to tell you a little bit more about the Enabling Eddie program. Over to you, Clem. Clem, you're on mute.
Thank you. Thank you very much, Carly. The Enabling Eddie program is a wonderful program that uses virtual technology to get people to understand what dementia is really like. We have those amazing goggles that people put on, and people then are taken through some scenarios. It's very, very simple, basically. Eddie wakes up at 3 o'clock in the morning. He wants to go to the toilet and he has to find the bathroom. It's not a difficult scenario, you would think. But for a person with dementia, that can be very, very difficult. So we've got 2 scenarios there. Then in the first scenario, it is very difficult. The property isn't dementia friendly. But the key issue for participating people is they actually experience what it's like to have dementia. There's minimal language there. So for people that speak 4 or 5 languages apart from English, it's the emotional learning that is the key. It's experience learning that's the key. And it really assists with change in attitude, knowledge, and empathy. That's the Eddie aspect of it, the virtual reality aspect of it. And most people actually get it. They really get it. And people are using the goggles sitting by a table or lying on the floor or however they feel the most comfortable with, and have this amazing experience. Thanks, Kylie. That's the Enabling Eddie brief description.
Thanks, Clem. So the focus of the Exploring Dementia program is this Enabling Eddie immersive workshop that uses a virtual reality technology to see the world through the eyes of the person living with dementia. In addition, and flexibly, dare I say, that we also include in the workshop a little bit about what is dementia, just to give people a little bit of a understanding about what dementia is. And we also delve into change behaviours, so exploring with the participants why people living with dementia experience change behaviours. And this session is really important because it helps participants to better understand the factors that may cause distress and then may influence behaviour changes in people living with dementia. And then we go on to work with the participants on what might be some of the triggers and strategies to better support their clients. And the Enabling Eddie virtual reality, they draw on that as well to have a think about what is it that causes people to feel distress and their behaviours change, and what is it in the environment and how you communicate with people that may be impacting. And most importantly, through the whole program, it's really what you can do as a family member, as a carer, as an aged care worker, what you can do to make the lives of people living with dementia less distressing, help them to understand more, help them to stay connected. And that's, I think, what we've really discovered. It's been a really interesting journey, and we've learned along the way how to adapt and how to design the programs to really suit the needs of each and every different community that we visit. So moving on, just to give you a little bit of information about where we went, what communities we visited, and how we did that. So up in far north Queensland, the Cape and Torres Islands, in 2018 and 2019, we went up. We delivered 33 workshops up in that region in some really remote areas, including Cooktown and Thursday Island, the Torres Islands of Bardu, Moa, Mobier, Innisfail, Mareeba, Atherton, Gelatin, Cairns, Port Douglas, Wudju, Hopevale, Bamaga, Weipa, Kawanyama, and Poporiru. So we really got out there into some of our remote First Nations communities to really bring this education directly to the people. We were very, very lucky to be able to connect with 240 local health and aged care workers, and really delighted to meet 59 community members, particularly when we were out on the islands of Bardu, Moa and Mobier. We met some absolutely wonderful people out there. And in terms of the funding, so there was a really great collaboration on the funding for us reaching up and going up into the Cape and the areas up there. And that was through the Northern Queensland PHN, the UQ Dreamt project, and Krana Price. So the Dreamt project from the University of Queensland, it stands for Dementia in Regional and Remote Communities, Empowering Aboriginal and Torres Strait Islanders to Seek Telehealth, telemedicine support. And it was established to implement and access telehealth services for dementia care in remote and rural communities. So it was a real lovely collaboration of organisations that brought Enabling Eddie and Exploring Dementia up into the Cape. And I'm going to pass back now to Clem to talk about the fantastic journey he went on up in the Northern Territory as he brought Exploring Dementia, Enabling Eddie to the communities up there.
Thanks very much, Kylie. Well, we went to Alice Springs, but the interesting thing about the Alice Springs workshops were that one particular organization brought in all their team leaders from the remote communities to the workshop. So in fact, while we ran part of the workshop in Alice Springs, we really had 13 different types of indigenous communities present at the table. In Catherine, which is about 300 kilometers out of Darwin, in Nhulunbuy, in Galawinku, you probably haven't heard of those places, Ramingining, Kapuwiak, Groot Island, Kalano, and in Darwin. And in a couple of weeks, I'm going to Mount Liebig, which is about a 4-hour drive from Alice Springs and to UNMU. We were very, very lucky that we were able to secure private funding for those trips. We are totally excited that somebody came forward to fund our remote travels. We're thrilled. Thanks, Kylie.
Thanks, Clem. So, just what were some of the benefits? How do we do things? How are we flexible? And with each of the deliveries, we arrived being very much ready to deliver in the way that the community was wanting to. So for some of the visits and some of the sessions, they were just short sessions out in the Torres Islands. We were doing just short sessions, 1 or 2 hours, and it was just more put the Eddie's kit on, have a talk. Talk about dementia, talk about their experiences, and talk about what might be some really simple tips and tricks. Then in some of the areas, we delivered half-day sessions. In others, we delivered full-day sessions. And sometimes it was en route to a location. You might have got a phone call. For me, it was one of the areas received a phone call saying, we can't do the full day, we've got to do a half day, can you change it? This is when I was probably about 2 hours away. And I went, of course I can, not a problem. So I think being flexible was one of the things that we really learned was really, really important, is to meet the needs of every community that's different. So one of the benefits of Eddie as a virtual reality program is that it's predominantly a visual immersive experience, as Clem mentioned. So it's really particularly suited to people non-English speaking, English as a second language. It's visual. It also has some very strong emotional responses, which help people to understand a little bit better about what the lives of the people they're supporting or their family members are experiencing, and makes the people feel a bit more open to some suggestions and exploring some solutions for how to better support people living with dementia. We did do a couple of surveys. It wasn't death by survey, but just a few questions to help gauge from our participant what resonated well with them. And some of just a couple of the results that I wanted to share was that between 95 to 100% of the participants indicated that their knowledge and confidence in supporting people living with dementia had improved as a result of the workshop. That was probably the best outcome we could have hoped for, that they felt more confident supporting the people in their community living with dementia. Also, between 73 and 90% of participants indicated that they agree that this workshop was really important to their role and useful in the workplace. Clem, do you want to share some of the comments that people made?
Thanks very much. So people can really identify with the characters. They sense it, they feel it, they give people a deep insight into the world of dementia. Quite often we find that because there's no word for dementia in many indigenous languages, that they simply don't understand what it is. And this gives them an emotional experience of dementia. And they found, wow, this is what my auntie has. This is what my mum has. Oh, now I understand. And now I can change this. And now I can help more. And so it was fantastic to sort of feedback that we got was amazing. It really helped people to understand what dementia is all about. For many, it was just a word prior to our training. And then people had the experience, and then they knew what dementia, or had an inkling what dementia was all about. Thanks, Kylie.
Thanks, Clem. And last slide, it's just really sharing some photos of the journey, the stories, how we got to different places, and some of the groups of wonderful people that kindly gave us permission to share the photos of their enabling any journey. One story that I quickly just wanted to mention, well, two quick stories for me, and that was down in Bardu Island. So in Bardu Island, in the evening, we were going for a drive and we saw a jetty, and we went for a walk around the jetty, and there were some young teenagers who were jumping off the jetty, much to my ghast, as the signs everywhere said, there are crocodiles in these waters, please don't swim. And of course, they were spurred on by my look of horror. Anyway, they asked us what we were doing, and we told them about the virtual reality, and they said, can we have a go? So we raced out to the car, brought out the kits. So we had these young teenagers with the virtual reality goggles walking along the jetty, really engrossed, really immersed, and they started talking about what it meant, and had some wonderful conversations with them. And then actually they went home and shared that with their family. And the next day, it's at the one of the workshops, then we had some people come along because the kids had actually shared that experience with them. Another community that I was in had a group of staff from the health centre and a group of staff who were out doing home care, and they realised a lot of brainstorming in the session, lots of ideas. They started to make plans for how they were going to raise awareness of dementia in their community, also how they were going to set up regular meetings between each other to support people living with dementia in their communities. So they realised that they weren't connecting anywhere near enough. And so we came up with lots of really good ideas for improving their support to people living with dementia in their community. Okay, Clem, did you want to add anything to that? Or
I wait for some questions perhaps that people might have.
Okay, over to you in the audience for questions. Sean, would you like to manage that? I'll stop sharing. Yeah. Stop sharing.
Right. Thanks.
Okay.
That's terrific. Thank you very much, both of you, for sharing what's a very interesting story, how you've taken this into communities. I would imagine for the first time, these communities are probably experiencing, especially the carers obviously, are experiencing what it must be like to live with dementia. So yeah, congratulations on what you've done so far. There's a couple of questions that have been asked in advance with people registered, and just a reminder, you can ask questions directly now if you want to type them into the chat box. But somebody's asked about cultural differences. How do you adapt, or do you need to change the program to suit the different communities that you go into?
Thanks. That's a really good question, actually, and thank you to the person who asked it. I think we've learned in the past that trying to make a program culturally specific can actually become undone because every different First Nations community have a different set of cultural beliefs and values. So the way that we approach it is we go into the communities saying, we are bringing to you dementia education. We are experts, I guess, in dementia. We're not experts in you, your families, your friends. You are the experts. So what we're going in, enabling people to do is think about being person-centered. So the whole concept of our programs is about understanding dementia and what is person-centeredness. What does it mean for your family member, for the people you're caring for? What is their story? So that's how we bring about cultural and cultural appropriateness. We actually put that onto the people who are in the community, working in the community, and their families. We come in educating about dementia and draw from them what is important to them and what's person-centered for them.
Great. And how prevalent is dementia in First Nations communities?
Yeah, so we know that in our First Nations communities, it's 3 to 5 times, dementia is present at a rate of 3 to 5 times more than in non-Indigenous communities. So therefore, we are looking at communities that really have a high rate of dementia. We know that there are a lot of risk factors associated with heart disease and stroke that are also risk factors for people living with dementia. So we talk about reducing those risks of heart disease and stroke will actually help to reduce your risk of dementia as well.
Mm. And Clem, this might be a question for you, especially since you're in the Northern Territory. Just for the audience, just give us an idea of just how remote some of these communities are.
Thanks very much, Sean. Now, the population of the Northern Territory is about $250,000 and $1,000, 250,000 people, but has about 1.4 million square kilometers. Now, for example, Victoria has got 227,000 square kilometers and 7.6 million people. So it's huge. That the Northern Territory is a huge place. The McDonald Shire in southern the Northern Territory is bigger than the whole of Victoria. So when we travel there, we fly for 2 hours and then drive 4 or 5 hours with different cars. In other communities, like for example the East Arnhem Shire, you can't even drive there. So you have to fly in with those wonderful little 4-seater planes, you know, every seat a window seat. It's fantastic. Those communities are so grateful that we actually show up. It's very rare that somebody specifically dealing with dementia runs a training program for them, and they're so grateful and so understanding. What we're doing is actually we're doing the hard work. We're reaching few people, but those communities are so grateful for it. And talking about that dementia is 3 to 5 times more likely in Indigenous communities, it also sets on about 15 years earlier. So there's a huge need out there, and we hear that people actually finally understand what dementia is all about by us visiting those places. Yeah. And
when you say the onset of dementia is 15 years earlier compared to, say, non-Indigenous
yes,
people, you're probably talking about people in their 50s. Is that about
That's
right?
Correct. The statistics are 1 person out of 10 over the age of 65 in the non-Indigenous cohort is likely to develop dementia. In the Indigenous cohort, it's 1 person over the age of 50 out of 10 that's likely to develop dementia. Yeah.
Gee.
Yeah, it's a huge issue.
I mentioned before, and I said that this is probably the first time that a program like this has been delivered in First Nations community. Is that true? I mean, I just made that comment thinking that it was probably the first time, but is this the first time that dementia education has really been taken into the communities?
That's to my knowledge, yes. And I've been
right
working for Dementia Australia for 6 odd years. So yes, Yes.
Yes, I mean, the enabling Eddie. So the use, obviously virtual reality is being used in some really innovative, amazing ways, including being used for people living with dementia to reminisce. So we hear the wonderful stories of the virtual reality being used in some aged care facilities, and the experiences in the virtual reality is about reconnecting with places they've been to in the past. This is a little bit different. Obviously, this one is actually the experience of living with dementia, and it is unique. It's unique to Dementia Australia. And yes, absolutely, bring this type of education using virtual reality up into these remote communities is a first for. In the context of dementia education, it definitely is. So, and as I said on one of the slides, nowhere is too far to go. We actually, to get to the Torres Islands, it's a 2.5-hour flight to Cairns. It's another flight to Horn Island. It's a ferry to Thursday Island. It's helicopters and planes to then the other islands. So. And we love it. We love being able to bring this education out into the remote communities.
And sorry, Carly, we're being as flexible as we possibly can. I'll just give you an example. A lady attended a course actually here in Darwin. She was from rural Darwin area, and she said, "Oh, that was great, but do you do something for kids?" Of course, we do something for kids. So she said, can I bring my 3 kids in? They're really giving us such a hard time. My mom just come to live with us and they're just horrendous. So I said, yeah, sure, bring your husband. We sit in the same room. And so I devised a little game where the kids could pick out a question from an envelope. So first we played a few games, but then they picked out the question. And one of the questions was, what's dementia? Okay. What's this? And why is Nana this? And so on. And then I made a mistake and I put a blank sheet of paper in. And the oldest one says, hey, there's no question in there. And I said, well, actually there is. There's an invisible question there. And this is the question that you really wanted to ask. So what is that question? And she said, well, why is mom spending so much time with Nana and got no time for us and typical teenage kids of that behavior. And then we had a conversation around, well, mom really wants to spend time with you, but Nana has got dementia. And, you know, what we've learned, there's nothing she can do about her dementia. But what can you do to help Nana? Have you read Nana's story? Have you sat with Nana and just being with her? Have you asked her how she is? If you help your Nana, then maybe mom has got more time for you. And about a month later, the lady rang up and says, oh, thank you. It was just like you clicked a switch. They're so much nicer now. And they're so much more helpful than they ever were. So thank you. That's, by the way, not written in any of our programs, but that's just how flexible we are. We have to be sometimes.
That's a great story, Clem. I mean, probably the first time I've heard that type of education for kids, but the way you've explained it, it makes so much sense, especially for Indigenous communities where it's very much a family effort. In fact, for any community, it's a family effort to sort of support people who are living with dementia. So we're sort of at the end of our session now. So thank you very much, Kaylee and Clem, for really shining a light on what the program is and the great work you're doing to take this into the communities and really support people who, you know, as you've said, you know, first time that this has really been done. So it really is a true milestone, I suppose, in education with respect to dementia. So for everybody on the session, there'll be a recording of this sent out later today, and it'll be available on the Inside Aging website as a permanent resource. So you're welcome to share this with your team and anybody else you think would be interested. So thanks again, Kaylee and Clem. Thank you.
Thank you very
Thanks,
much.
Sean, and thanks everyone.
Absolute pleasure.
Thank you.
Great, thank you.